Hi, I am Dr. Ishan Shevte, a shoulder surgeon. Today I am going to talk about early symptoms of frozen shoulder and how you can prevent yourself from going into a stage of frozen shoulder. Frozen shoulder is basically tightness of your shoulder joint, which happens over a period of months. You develop pain, you start developing stiffness in your shoulder, and daily activities of routine, taking your hand behind your head, putting it in your pocket, or putting on a jacket, that becomes a problem. So what are the early symptoms you can recognize for this frozen shoulder? First and foremost is pain. You'll start getting a dull aching pain, maybe throughout the day, more after doing any activity, and it gets worse at night. There is no particular area of pain which you will find. It will be a generalized pain over the shoulder and over the arm. The second complaint is stiffness. Slowly, steadily, you will start getting stiffness. You will not be able to do your daily routine activities, which involves taking your arm above the shoulder level, taking it behind the head, behind the pocket, or putting on a jacket. The third symptom would be these complaints will progress. Gradually the pain will increase, the stiffness will increase, and it will last for months together. So you need to recognize these complaints as soon as possible. Now, how to prevent this? How to prevent the frozen shoulder from starting, or how to prevent it from going into progressive stages? So firstly, the most common reason for this frozen shoulder is immobilization, or you keep your arm in a certain bag or a pouch for a longer period of time because of a surgery, because of some injury. It may be to the shoulder, to the elbow, or your forearm. So as and when it is safe to take it out of the shoulder pouch, you should consult your doctor, take it out of the pouch, and start your exercises as soon as possible whenever the doctor suggests you. Putting it extended period of time will not help the injury recovery, and it will add up to your frozen shoulder. The second common reason is your bad posture while sitting, while doing your desk work. If it is in a slouchy position and you tend to bend down and work at the laptop or your desk, that may develop into a frozen shoulder or a stiff shoulder. The third common thing is your blood profile. Having a high sugar level, HbA1c, which is 3 months test of sugar being high, or your thyroid being problematic, that can also land you in frozen shoulder. Another point for prevention would be if you are a regular gym goer, if you are into lifting heavy weights, over shoulder activities, if you injure your shoulder in your routine sets of exercises, you should take adequate rest and again start your physiotherapy or your exercises as routine. If you keep your shoulder rested for a long period of time after overuse injury or any gym related injuries, it may over a period of a couple of weeks to months may develop into a frozen shoulder. So remember all these points I told you. If you are suffering from any sort of these problems, get consulted as soon as possible. A shoulder surgeon, get consulted with a physiotherapist, and start the treatment as soon as possible so that you don't land up in a bad phase of frozen shoulder. Thank you.